This video demonstrates the multifunctional use of the 25 gauge vitreous cutter during vitreous surgery for diabetic macular traction retinal detachment. I follow the outside-inside technique by making an opening in the posterior hyaloid and subsequently extend this opening 360 degrees. Subsequently, the edges are trimmed so as to reach the fibrovascular proliferation in the posterior pole with a setting of 5000 cuts 400 suction. I am now using the cutter as a forceps so as to release the focal adhesions and subsequently as a blunt dissector so as to create a space underneath which I insert the cutter and convert the cutter into a scissor. Here I am inserting it underneath the fibrovascular proliferation, lift and cut with a setting of 5000 cuts 50 suction. So this segmented tissue is now being removed. The focal adhesions are being removed by again inserting the cutter underneath the focal adhesions, and by using the shave mode they are released, and subsequently the fibrovascular tissue can be eaten up with a 5000 cuts 400 suction setting. This is a very useful technique, very effective in most cases of advanced proliferative diabetic retinopathy. Very minimalistic surgery. One instrument performs the function of a forceps, scissor, blunt dissector and a cutter. The surgery has been completed with the versatile 25 gauge retractor. Thank you.